All right, well, good morning all, and we'll get started. As I see, we have a number of our community members and friends joining in. So exciting to see everyone. Let's get the ball rolling. So welcome to all, and I'm so happy to see so many familiar faces this morning, and thank you for joining us. It's a really special moment for us and great for us to get together again to talk about building healthier communities on the south side of Chicago. I want to let everyone know, first and foremost, that this session is being recorded. And we do so that we can share it with those who wanted to join but couldn't make it with us here today. My name is Rashad Johnson, and I have the pleasure and privilege of serving as a president of Advocate Trinity Hospital, as well as Advocate South Suburban Hospital. And I'm also the chair of the board of directors for our Southside Healthy Community Organization, or as we affectionately call it, the SSHCO, which is an incorporated nonprofit dedicated to healthcare transformation on Chicago's South Side and focusing on the health equity. For those new to this conversation, the SSHCO started initially as the Southside Transformation Project, and it's driven by significant input from our community members about the disparities within our community and barriers to access to care, and then the changes that we need to see take place. We're a collaborative of healthcare providers consisting of safety net hospitals, our federally qualified healthcare centers, health systems as well. And we're on the south side of Chicago, and we came together to address these significantly developing issues with a plan to focus on primary care as well as specialty care, preventative and chronic care management, care coordination management, as well as provider collaboration, community engagement, and connecting digital and technology as far as our infrastructure to build that bridge. All of us are here today to take part in this collaboration, and we started and we're better together for this work, connecting our existing organizations, leveraging our assets, increasing our access to care, and addressing some of the most challenging social determinants of health to ensure ultimately that we have a stronger, healthier community on the south side of Chicago. As many of you know, one of our goals is to keep our community updated. And in this process of establishing our organization and building health equity for all on the south side of Chicago. Our last town hall was February 28th. We had a number of people, a great turnout, over 220 attendees. And we shared a number of updates as we had our conversations about the work we're doing, including the setup of our new non-for-profit organization. There's a lot of basic work, a lot of decision-making, need to build the infrastructure, the architecture, and ultimately the impact that we all want to see, which is significant and sustainable as far as access to healthcare and as far as health equity within our community. Just a few highlights that I want to share from our last town hall, just as reminders. We shared updates and plans for hiring later this year, assigning a new primary care providers to our FQHC sites that are a part of our SSHCO. And we also shared with you the first step of the hiring process, which included hiring our community healthcare workers that we know are the glue and the fabric behind bridging our community and building that trust. And also not only our community healthcare workers, but in our nurse care coordinators within the first year. These are hires that are going to be spread amongst our 3 FQHCs, that's Friend Health Center, Beloved Community Wellness Center, and Chicago Family Health Center. Ultimately, every site among our 13 collaboratives, when we look at our primary care need, we'll have these additional primary care providers, and we're looking for up to 90 additional primary care providers over the next 4 years. That is a substantial investment and need for us in order to create the access that's necessary. The process is well underway, and you'll hear more about this later on today, and we're excited to share those updates. In addition to these hiring plans, we also shared with you that we're connecting and utilizing new technology systems. We have a lot going on in this area. As you can imagine, 13 different healthcare organizations that are part of our coalition, and how many different technology solutions there are. That makes it exciting. That makes it a very dynamic organization and gives us some new things and some cool technologies in order to work on to build a bridge for our community. The SSHCO has a work group, and we're dedicated solely to the social determinants of health. In particular, when we look at the lack of access to nutritious food, when we look at housing, job opportunities, transportation, and more, these are things that drive us. These are things that we feel like coming together collaboratively, we're going to address. And during our last town hall, we shared that our work group put together a request for information. And this request for information was sent to a broad list of community stakeholders, community organizations, and those who can partner with us on the South Side to provide services for our residents. You'll hear more about that process today as well. We're excited for the feedback that we've gotten and just the energy that's been surrounding our community organizations in terms of partnering with us and moving forward. We also talked about the active process of searching for our new CEO of our organization. And you can see the smile on my face. I'm very happy. We're very excited to announce that we have chosen a great leader, someone who has the fortitude, someone who has the vision to carry us forward. Ladies and gentlemen, this morning, you'll meet our new CEO, Kimberly Hobson. And we wanted to bring her to the community first. And then we wanted to share the news more publicly as we have this conversation with her. And so you'll get a chance to meet Kimberly and dive in deep and hear her vision. So welcome, Kimberly, and thank you first and foremost for joining us. We're looking forward to your leadership for sure. So here's how we'll spend the next hour together. A number of my fellow board members will be reporting out. So I want to go through this agenda to bring everyone up to speed. First, you'll hear from Margie Johnson, who's the CEO and Executive Director of Beloved Family Health Wellness Center. She'll share a number of specific updates with you around our progress. Next, we'll turn it over to Crystal Hamilton, who's the President and CEO of UCAN Chicago, one of our community board members as well. She'll moderate a dialogue with our new CEO, our dynamic CEO, Kimberly Hobson. So you'll get to know her and hear firsthand what her vision is and her goals for moving the SSHCO forward into the future. Then we'll open things up for your questions. It's important that we hear from you. Diane Sinclair, who's the VP of Community and Organizational Development at St. Bernard Hospital. Diane is also the Secretary of our board, and she'll facilitate the Q&A session, and we'll answer all the questions that you have, and we ask that you bring that forward. That's one of the more exciting parts of this dynamic conversation with our community members, is to have that chat and have the ability to dialogue. Just a reminder, there's an online chat function that's open, and you can use the button to the bottom of your screen. So please use it and type in your questions along the way. We hope to answer a few of those within the last 20 minutes or so during the session, and we have that. And if we don't get to it, then we'll give written responses after the event. So please direct your questions to the chat. There's Parita Nalaswamy, and she can compile them, and she'll share them live during the section of the town hall. And before I give the virtual floor to our speakers, really want to acknowledge our elected leaders, our federal, our state leaders, and local leaders who have all been extremely and tremendously supportive and engaged during this process from the very beginning, and we would not be here without them. So we want to thank those leaders who are also present with us today. And I also want to especially recognize the Illinois Healthcare Family Services leaders for their tireless efforts to build a healthy and equity community, not only here, but across the entire state. So with that being said, with all the excitement, you've heard enough from me and in terms of the welcome, let's open this up and we'll dive into our updates, and I'll turn it over to Margie.
Thank you, Rashad. And hello to everyone this morning. As Rashad has stated, my name is Margie Johnson, and I am the CEO of the Beloved Community Family Wellness Center. I have the exciting task of sharing some specific updates around the progress we are making on our Healthy Communities model. I believe every person deserves to live a healthy life, and it should not be based on their economic status or the racial demographics of the communities in which they reside. We have been doing a lot of work to build the organization in a way it can be ready to add resources, to hire more doctors, nurses, community health workers, and care coordinators in order to provide better access to care and health outcomes. The Southside Healthy Community Organization is about making an impact on health on the South Side. And we know this takes time. And we want it to be a sustainable, transformational impact. We are steadily making progress, and we have some good news to share. I, along with my fellow colleagues, are very passionate and committed to transforming healthcare on the South Side. This slide may look familiar to many of you. It is the Southside Healthy Community Organization's model for transforming healthcare in our community, which was formed based on key issues and ideas raised by you and other members of the community during our community engagement process. I want to take each pillar of the model and let you know how each has moved forward over the past couple of months. At our February town hall, we talked about the planning underway for hiring up to 10 primary care providers by the end of the year. And now we have some specifics around that. These are doctors and nurses who you see for your well visits, for checkups, and they help connect you to doctors with additional expertise based on your health needs. These 10 primary care providers are targeted to be hired by the fall of this year, and they will be placed among 3 of the 6 federally qualified health center partners in our organization. They are Friend Health Center, My Clinic, Beloved Community Family Wellness Center, and the Chicago Family Health Center. Ultimately, every site among our 13 collaborative partners with a primary care need will get additional primary care providers, up to 90 additional over the next 4 years. So the first 10 are a start and a good one. And we will continue to add access to basic care as time goes on. In addition to the basic care you can get from your primary care doctor, the Southside Health and Community Organization is also hiring specialists. These are doctors, nurses, and counselors who have an area of expertise, such as maternal health for pregnant women, or psychiatrists who focus on behavioral health. The numbers are very sobering when it comes to the maternal health of Black women on the South Side. Sadly, this population experienced much less favorable health outcomes compared to other racial and ethnic groups and face many more barriers to high quality care. For instance, Black women are 2 times as likely to experience severe health issues during pregnancy, like hypertension, hemorrhaging, and more. Black women are 3 times as likely to die within a year of their pregnancy. And they are 8 times as likely to die from a pregnancy-related medical condition like preeclampsia, severe anemia, or gestational diabetes. Of course, we want to change this. We are targeting this fall to bring on 2 OB/GYN doctors who cares for pregnant women and 3 advanced nurse practitioners who specialize in maternal health, who will focus specifically on providing ongoing care for these moms. The idea is to have providers who can see patients from prenatal to delivery to postpartum, with some connection to newborns and pediatric care, if it is available at their medical home. And again, this is a start. We need to walk before we run. And then on the behavioral health front, as we shared in our February town hall, behavioral health is a huge priority based on community needs. Behavioral health is how we care for one's mental health, things like depression, drug abuse, alcohol addiction, and more. The Chicago Department of Public Health just announced additional trauma-informed centers of care, and some indeed will be located on the South Side, which is very good news, but we know the need remains great. We have assessed what is available at our 13 organizations regarding behavioral health needs and plan to start by hiring 2 psychiatrists by the end of this year. who will be deployed to see patients through the Southside Healthy Community Organization. Additionally, we are looking at options for more access to telepsych services to broaden our reach even farther. Telepsych is a way for patients to access this type of care by phone or video rather than in person. And there is much, much more to come. Again, this is a start. In terms of social determinants of health, we shared updates on this at our last town hall. Requests for information. We put out a broad list of community resources, held questions and answers sessions, and we have received around 40 responses from a variety of community organizations who provide services that could help support our patients and residents and improve their health. We built a database of these resources and have kept the portal open on our website. If you know of and are a community organization or business that might help support key healthy resources needs like transportation, access to nutritional food, good jobs or housing, it is not too late to share your information through our website at www.southsidehealthycommunity.com. Again, www.southsidehealthycommunity.com. We have no specific yets on partnerships or an RFP, but we want to be ready when the Southside Healthy Community Organization is ready to tap those important resources. We have also signed a contract with Unite Us, a software tool that would allow our care coordination staff to access community-based resources at a click of a button and make a referral of those resources to our patients. We've made a lot of progress on the care coordination front. Community health workers are staff who can help patients to make appointments, connect with their doctors, and more. In our model, these staff will be in our emergency department and at our clinic sites. We are excited to share that job offers are going out now to the first wave of community health workers, 11 in the first wave, and then we plan to bring on another wave in September and a third wave in November, targeting 48 community health workers onboarded and active in our neighborhoods by the end of this year. Hiring from the South Side is a high priority for this process. You all should have received the notice we sent directly to you for these job opportunities. And similar notice will be sent before August and November's hiring waves so that the community can actively participate in these job opportunities. We are also currently interviewing and hiring nurse care coordinators, 20 by the end of the year, and starting with 7 in the first round. Nurse care coordinators will help patients follow through with their treatment plan from their doctor. The first wave of both community health workers and nurse care coordinators will work out of the Near North Health Center, Friend Health Center, and St. Bernard's Hospital. And then by September, the next hires will be placed at the Chicago Family Health Center, TCA Health, Roseland Hospital, and Jackson Park Hospital. The third wave will be placed at our hospital emergency departments and FQACs, which are Christian Community Health Center, Beloved Community Family Wellness Center, South Shore Hospital, and Holy Cross Hospital. So by the end of the year, we hope to have 1 to 4 of these workers at least in all of our 13 locations. So now, how are we doing to connect all of this together? We are building out a connected care platform that would allow these community health workers and nurse care coordinators at our 13 sites of care to collectively document patients' needs, develop care plans, and monitor and support patients' progress. For example, a community health worker can document the present needs of Yvette, a patient, when she comes to the emergency department of St. Bernard's Hospital, and arrange for a follow-up appointment at the Beloved Community Family Wellness Center, which is Yvette's primary care medical home. And the community health worker at Beloved will have all of Yvette's information at their fingertip when she comes to her follow-up appointment. These workers will have access to the Unite Us platform, as I mentioned earlier, making it easy to connect all patients to other community-based services they may need. The idea is to bring together more sites of care into one big care team whose sole focus is on the health of the patient, no matter where they receive primary care on the South Side. In closing, I feel we are moving in the right direction and making this information presented today a reality for our patients and community residents. We are hiring people, including our new CEO. So now, let's turn the presentation over to Ms. Krista Hamilton, President and CEO of UCAN Chicago.
Thank you, Margie, for those incredible updates. I mean, I'm a part of the board, and just hearing all of the things that we've accomplished makes me so proud. So I hope everyone enjoyed hearing what we've done over the last year. Good morning, everyone. As Margie mentioned, I'm Krista Hamilton, President and CEO of UCAN, where we provide supportive services to more than 20,000 youth and families across the state of Illinois who have suffered trauma. Our programs focus on young people from as far south as Roseland, as far west as North Lawndale, but also throughout other parts of the state. I am one of 3 community board members for SSHCO, and I have the great privilege of today of introducing our new CEO, Kimberly Hobson. I think I have the best part of the presentation. Kimberly, we are so happy to have you on board. Welcome, welcome, welcome. Will you please start off by sharing with all of us a little bit about your professional background and what is your connection to the South Side of Chicago?
Thanks so much, Krista. I am so excited to be here today. Good morning to everyone that has joined us this morning. I am incredibly excited. I'd like to begin by sharing that I am honored, and I certainly consider it a privilege to serve as the inaugural CEO for the Southside Healthy Community Organization. I would also like to acknowledge the state of Illinois for believing in this work and providing the resources to move it forward. And so in terms of connecting to the South Side of Chicago, I was born in Chicago, and I was raised on the South Side of the city. I matriculated through the Chicago public school system for elementary as well as high school. My adult children live on the South Side of Chicago, and my grandchildren live, and they're also being educated on the South Side of Chicago. And so my roots are deep there. For approximately 28 years or just a little more, I've worked in the healthcare on the South Side of Chicago in healthcare. I've worked across the entire spectrum of healthcare. I worked for Humana Health Plan and Advocate Healthcare, Mercy Hospital, and then University of Chicago for 17 years. And most recently, I served as the CEO of Journey Care, which is the largest hospice and palliative care organization in the state of Illinois. And when I was there, I had the opportunity, along with my staff, of course, to rebuild the organization. And we were able to yield financial and operational sustainability. And it actually led us to an $85 million sale of the organization in February of 2022. So I am excited about this again, and my roots are deep on the South Side of Chicago.
Well, I am a native Southside as well, so I am happy to have you in this seat. Such an impressive background, Kimberly. So it sounds like you could have done a lot of things at this point in your career for a next step. What drew you to the Southside Healthy Communities Organization?
Oh gosh. Krista, many things drew me to the Southside Healthy Community Organization. You know, as I mentioned, my roots are deep on the South Side of Chicago, and I am absolutely passionate about this work that we're doing here. You know, having lived on the South Side of Chicago and lived in this community for such a long time, I know the disparities and I know what they look like. I've also had the opportunity to experience fragmentations in the delivery system, and that's a huge thing. I am looking for community engagement and knowing that the collaborative and the community engagement are the foundational principles of the SSHCO. And that's where the work is built upon. And so that's refreshing to me, and that caught my attention. And you know, as I began to learn more about the Southside Healthy Community Organization and started to do my little research, I realized that the healthy community model, which drives this work, it really is not a Band-Aid solution. I see it as a comprehensive approach to health transformation. And that was huge for me because putting Band-Aids on is what we've been doing for such a long time. And the opportunity to look at this from a comprehensive perspective and have the resources to do that was very exciting for me. I also truly believe that no one, and I think Margie alluded to this, no one should be sicker, no one should be dying younger because of where they live. And I want to be a part of the SSHCO so that I can be a part of what that commitment to work on this work and positively impact the reality of better health on the South Side of Chicago. And I'll finish up by saying, I also feel that my work and my life experience has led me here. And I also like to say, I believe it's in divine order. I believe I'm supposed to be here. And so thank you guys for having me. I hope and intend to work with all of you so together we can have a meaningful impact on building a strong, efficient, caring, and sustainable organization that will make a difference in improving the health in our communities on the South Side.
Wow, Kim, we are so lucky to have you as our CEO. So where do you think you can make the most impact overall?
Wow. I have thought a lot about this over the last couple of weeks and even before I started, but you know, I can't tell you one thing, Krista. Of course, I'm not going to follow the rules, but I believe I can impact this work in a variety of ways. I am humbled by the good fortune that I've experienced throughout my career, and I have learned what is needed to be impactful. And so, you know, I think I can make the most impact by doing a few things and leading a few things. I believe that keeping the community engagement at the helm and at the forefront of everything that we do is critically important. I also know that we have 13 partners, and so mobilizing these partners to continue to work together toward the common goal and remain laser focused on the common good of the people in our community is key. Also, it's important for us to ensure effective program design and operational efficiencies to make sure that these programs are running appropriately. And also monitoring outcomes and course correcting as appropriate. And so when I say course correcting, I believe it's important to say that because even though we put together programs and we design them, and sometimes when they're put into action, you realize that this one thing may need to be adjusted or that one thing. And so I am not afraid to course correct when appropriate, and we'll be doing so if and when that comes up. So, you know, staying focused on all of these things will certainly keep us moving forward as we strive to transform health on the South Side of Chicago. So once again, I'm excited.
I feel like you've mentioned it already, Kim, but can you just tell us in a few words, what would you say your big picture vision is for the Southside Healthy Communities Network?
Well, so my big picture vision, all my little 3 weeks here, huh? But yeah, I see the Southside Healthy Community Organization as a driver for real change. That's what I see. I visualize it as the catalyst by which healthcare on the south side of Chicago will truly be transformed. And I believe that it will be transformed as we increase access. Our aims will be to reach increase access and equitable and high quality care and reduce health disparities and ultimately improve our outcomes. That's where we're headed, you guys. And I really believe in this, that this vision is doable. I wouldn't be here if I didn't. I believe the vision is doable. I see real power in these organizations in the community coming together. I mean, think about it. We have community-based organizations. We have faith-based organizations, Southside residents, hospitals, clinics, legislators, health systems. And then we have the state that has been so gracious to provide these generous resources, and putting all of this together will allow the best opportunity for us to succeed in a comprehensive and sustainable way. So I believe this, you guys, we have all of the ingredients to really make a difference. And so I say, let's continue to work hard. Let's continue to work together and be the difference that we actually say we want to see.
I agree. I couldn't agree with you more. The vision is doable, Kim, and we know that together we will continue to see work hard and make a difference. Yeah, I know you mentioned you've only been here 3 weeks. So over the next 100 days, you know, what are you going to be focusing on? What are you going to be spending your time on?
Well, you know, I thought a lot about this as well, and I'm sure I'll continue to think about this as we move forward. This is an iterative process, but you know, over the next many months, I will be focused on continuing to drive toward reaching our one-year deliverables, especially working to hire, you know, the first wave of primary care physicians that Margie mentioned, and specialists in mental health and maternal health. We also will be getting the care coordination model up and running so that we're out in the community. We'll be sharing information and connecting people to the services that they need, and that's important. We're also making sure that the IT systems are in place to support this work, because we've got to make sure that we have a foundational IT platform to support this work. And, you know, if you think about all of the things that you've heard thus far, this is an intense time for this organization. You know, this is a new organization, even though the board and so forth has been working for well over a year. But this is a new organization, and we're working to put all of these puzzle pieces together and to ensure effective execution of that healthy community model. And so we want our staff to feel supported. We want our community to feel engaged. And so what we're doing is we'll continue to engage the community. We're also making sure that we provide appropriate equipment and training to our staff, and that we are creating an inclusive culture. And we want that culture to be centered around communication and collaboration. So I would say that this work is on track. And the time that I've been here, I've focused on whether or not this work is on track. And I say this work is on track, but there's a lot more to do. And my job is to keep us moving forward and to keep us on task. And I certainly plan to work together with all of you to make this happen.
You know, I think our colleagues have mentioned earlier, we've had multiple town halls, and the community has just been so engaged, as evidenced today, as so many people joined our town hall meeting. You know, but when will the community start to feel the real benefits of this organization? When might they see the words on the papers turn into real action and access?
Yeah, you know, I'll begin by acknowledging the hard work of the board of directors and the staff from their various organizations. We talked about, we're at a certain place, but we're only at that place because the board of directors and staff within their organizations have worked so hard. And so the work that they have accomplished over the last year plus is remarkable, and it's gotten us to where we are today. And so, you know, I believe that we will start to feel some benefits soon. As I mentioned, we are beginning to hire the first wave of community health workers, and then we'll hire an additional wave, as Margie told us, in August, and then another wave in November. And by the end of the year, we certainly hope to have onboarded nearly 50 community health workers who will be located throughout the network to help access support and care. And that's huge. That's a really big start. We're also actively recruiting, advanced practice practitioners and physicians, and these positions are hired and they'll be deployed across the South Side of Chicago, and we will begin to see increased access and resources in those particular communities. And I'm asking for your patience, though, because I believe Margie mentioned that we want to make sure we do this right. And so, although a great deal of progress has been made and we've got a lot more to do, we'll stay focused on our deliverables, of course, but I want you to be patient and keep in mind that, we'll continue to make progress over a period of time. I want to make sure, I really want to make sure that we do this right and in a way that is sustainable, because our goal is to close the health equity gap. And that's done in a process. It's more effectively done over a period of time. That's when you get it right. And so I believe this effort is focused on getting it right.
Absolutely, Kim. Talk a little bit about, we may have some people that are new to the town hall and the SSHCO today. Talk a little bit about the social determinants of health that plague the South Side and other under-resourced communities throughout our city. How will the SSHCO make an impact on the decades and decades of neglected neighborhoods without access to things like healthy foods, transportation, good jobs, and good homes?
Yeah, this social determinants of health is a really big thing. And I think about this all the time. And I certainly in my career, I see it, I know it's real. I've worked on programs to address it. But, when I think about it, it takes me all the way back to this. We know that healthcare itself is essential to good health. But we also know that there are other factors that impact overall health. And when you think about social determinants of health, they really are the economic and the social conditions that influence individual and group differences in health. And the data and the research really, sometimes surprises us, but it indicates that social determinants of health actually have a higher impact on population health than health itself. And knowing this, the Southside Healthy Community Organization has plans to reach beyond clinical interventions and to address the needs of the whole person, and that's these social determinants of health. And so Margie mentioned that in order to address social determinants of health, we have reached out to faith-based organizations, social service and community-based organizations, and built a database of resources with whom we can seek partnerships with at the appropriate time. A subgroup has been put in place to work specifically on the social determinants of health and program design around that. And so this work has begun, and we'll be advancing this work over a period of time. So what I want you to do in this area is to know that this is critically important to us, and we are doing the work. And so I want you to stay tuned, and we will be advancing the social determinants of work very soon.
Thank you for all of that. How do we see the community remaining central to the work of the SSHCO? Community has been such a big part of what we've done, how we've gotten here. How will their voices continue to be front and center in both the plans and operations as we move forward?
Well, thank you for asking that question. And this is a big deal for me. I want you to know that the community is, and it always will be, front and center in everything the Southside Healthy Community Organization does. I know that before my time and even now, that there was a lot of great community engagement through town hall meetings, small group listening sessions. I believe there were surveys, and the website continues to be an interactive portal where people can share ideas and ask questions. And so, that engagement will continue as we will all put in place a more formal process for an additional layer of community input through the development and the activation of a community advisory council. I see this community advisory council as being that extra layer of community involvement up front and center. And it will be up and running, I will say, within the first quarter of next year. So, begin to look for that in the next several months. In the meantime, community engagement remains important to us, and we'll continue with town hall forums like this every 3 months or so. We'll continue with our direct mailing messaging when we have something timely to share with you. Also, we are also posting information, resources, and news on our website and our social media channels. So please follow us on Facebook and LinkedIn and on our LinkedIn pages, and check in on our website frequently. Community engagement is important, and we will continue to press forward with that.
You have such a big task ahead of you, managing 13 different organizations who've all come together in the pursuit of building health equity on the South Side. You know, this must be a lot to manage. You know, tell us, how do you see leading the charge and keeping us all on the same page and rowing in the same direction?
Yeah, well, it can be. Well, Krista, I believe that, it may be a lot to manage, and I believe that it may be, but it is certainly manageable. And I think that's where we have to look at this thing. Lots of people, lots of ideas, lots of thoughts, but it is manageable. I've only been on board for a few weeks, which you said, but I'll share my initial observations as it relates to this. And keep in mind that this is an iterative process. And so, things will be moving throughout this process, but I want to share my initial observations. I see these 13 organizations as having come together with the same commitment and mission in mind. And that is, of course, improving health outcomes on the South Side of Chicago. And so I've had several individual meetings with board members. I've attended a couple of board meetings in and of themselves. And what I see healthy and respectful challenge and commitment. And so although we have all these, 13 individual organizations, and we have the community partners and so forth, we all have the same goal. And we all want to see better access to support and care, and ultimately healthier communities on the South Side. And so perhaps we will have some challenges. Perhaps when you got all these individual thoughts and ideas in a room, that you will have some challenges as we move forward. However, this group is respectful of each other, and they realize that there are so many benefits that will result from this work, and those benefits outweigh anything else. And I think that all of us have kept this in mind every single day. Everyone in this group brings great experiences, they bring great assets, energy, ideas to the table, and I feel it's my job to draw the best out of all of our partners. I mentioned mobilizing our partners at the beginning, and that's a critical part is mobilizing these partners. But my job is to draw the best out of all of our partners. So our combined organization is as strong and as impactful as we can possibly be.
Oh, thank you, Kim. I will say I've been working with these partners for the last almost year, and it has simply been a joy. Everyone is deeply committed to the goal. So I think it's going to be very manageable for you. But before we take you off the hot seat, we've learned a lot about you professionally. We want to know a little bit more about you personally, Kim. What do you do when you're not working?
Well, what I do when I'm not working, okay, so people think I work all the time, but I'm going to tell you a secret, I don't. I like spending time with my husband, my adult children. I have 4 adult children, I should say. My grandchildren, my extended family. My family means everything to me. And so spending time and cooking and having them to my house and going to their houses and traveling out of town to see them it brings me so much joy. I also like to hang out with my girlfriends. I have a couple of book clubs that I'm a part of, for one of them for almost 20 years. And so
Wow.
We do all things together. We read books, we talk about books, we laugh, we cry, we eat together, we celebrate birthdays together, and those things are really, really fun. And also, I like to do things like cooking. I like to read. All of these things bring me joy. And so believe it or not, I work really hard, but I don't work all the time. And I find joy in doing some of those things.
Well, that is good to hear. We want you to have a nice balanced life. Okay, a quick lightning round. Favorite food?
Mexican.
What book are you reading right now?
Finding Me by Viola Davis. I actually have my book club meeting on Friday night.
I actually want to read that. Somebody told me to get the audiobook. Okay, are you pie or cake?
Cake.
Pie or cake?
Cake.
Okay. Salty or sweet?
I like them both, but maybe I'll choose salty over sweet.
Okay. What might surprise us about you?
So I think what might surprise people about me, because they see me work quite a bit, is although I love my professional life, I would also say that I'm actually a domestic diva. I love to cook. I love to bake. I even like to make homemade ice cream, and I make it in a variety of flavors. So when I make it, I'll let some of you guys know. And although I don't have a whole lot of time to do it anymore, I actually sew and make beautiful clothes. And I've been doing that since I was 12 years old. So those are the things that might surprise you about me.
Okay, and lastly, 3 words that describe your leadership style.
Collaborative, visionary, and I'm going to cheat here, servant leadership.
Nice. Thank you, Kimberly. Thank you so much. It was a pleasure getting to know you today. I know I joined the other members of the board of directors and the community and feeling very excited to have you at the helm of our important organization. Your background, your experience, the deep connectivity on the South Side of Chicago, and your passion for the work, made you rise above all of the other CEO candidates. And we had some really good candidates in our search. We are glad to know that we won't be making all of the decisions by ourselves anymore. And we have such a qualified CEO to move us forward. We've been putting in a lot of work, so you don't know how happy we are to have you. You have our 100% support, and we look forward to just making an impact and building healthy communities together with you. So thank you so much, Kim.
Oh, you're welcome. Thank you so much for having me. I appreciate it.
I am going to turn it over to my colleague, board member Diane Sinclair, VP of Organizational and Community Development of St. Bernard Hospital and Secretary of the SACO Board. Take it away, Diana.
Well, thank you, Krista, but I'm not sure if anybody's going to want to listen to me after that exciting segment, but I will do my best. Krista, we really appreciate you taking the time to help us to get to know more about our new CEO, Kimberly. And Kimberly, your passion and commitment, I think, is exactly what we need at this time, at this moment, for the work that we're trying to do. As Krista said, I'm Diane Sinclair. I am the secretary of the board, and I'm also a VP at St. Bernard Hospital, a safety net hospital in Inglewood on the South Side. So this morning, we took a lot of time to try to give you some updates, introduce our CEO, and let you know the work that we're doing, which is all community driven, as we try to improve health on the South Side. But it is also critical that we hear from you. So I am going to be now hosting the section where we are going to answer the questions that you have prepared. So whether it is questions that you have submitted through the chat or questions that you have submitted to us previously. We take the time to look at the questions that were submitted in previous rounds that may not have been addressed, or progress that may update those answers. And we're trying to do that today. So you can still submit questions. You forward them to Parita in the chat, and we are going to display the questions, and then we're going to move on. So we are going to have Parita put up our first set of questions. So the first question is, tell us more about the community health workers and nurse care coordinators. When will the community start to feel the benefits from these? And when will these start to address resources? Krista, can you take?
Yeah, I'll jump in. I believe one of my colleagues mentioned it earlier, but job offers were made in mid-June for the first wave of 9 community health workers plus 2 managers for those workers. And we have training planned for the first round of new workers starting now and over the next few weeks. We are still in the hiring process with the nurse care coordinators, 7 in this first round. These first new hires will be spread amongst Fran Health, near North and St. Bernard Hospital, and should be active about mid-July. By the end of this year, we are targeting to hire up to 48 community health workers and 20 nurse care coordinators spread amongst all 13 healthcare partners, and much more to come in the future.
Thank you, Krista. Now, Margie, I know you mentioned it in your presentation, but I'm going to raise the question again. How will more of these kinds of job opportunities get communicated to the wider audience, to our communities? Margie, you're on mute. Sorry.
Sorry about that. We are hiring these important community positions in phases so that the community can actually participate, and the individuals that we're hiring get the appropriate training. that they need, and that the appropriate oversight that is needed can be provided for these various positions. They will be placed at the various FQHCs, the hospitals and health systems in our network. We plan to hire another round of community health workers in September and November. So we're looking now, and we will be communicating all of this through our website, which is www.southsidehealthycommunity.com. Again, www.southsidehealthycommunity.com. We'll also do this through our Facebook and LinkedIn and social channels, and through direct outreach to our 2,000 plus database, like we did for the May and June opportunities.
Thank you so much, Margie. So Ms. Kimberly, our new CEO, you're not off the hot seat just yet. So we've talked about the Community Advisory Council, a number of meetings, I think from the very beginning. So now that you're on board, can you let us know when might we see some progress on this?
Yeah, I mentioned this a little bit earlier, but I'll just try to recap some of the things that I've already mentioned. I talked about, being pleased to community needs and input and ideas and so forth and so on have been front and center since the beginning of the Southside Health transformation process. It's been from the very beginning. And so I think that's critically important to continue to reiterate, that we'll continue to this for sure as I continue on as the CEO. We still have a lot of building blocks to do to implement a foundational structure for the SSHCO. You might be surprised, but maybe you're not surprised at how much work it takes to start an organization from scratch. Even with all 13 of our awesome partners and our community partners that sit on our board. And I believe it's important that we get it right, as I mentioned, as we move this thing forward. We have got to move it right, to do it right, so that we can be a sustainable organization and we can have the impact that we want to have. And so, we'll continue gathering input and conducting these community town halls and so forth and so on. But I also want to see an additional layer of community involvement. And again, that's the Community Advisory Council. And so, by the first quarter of next year, we will start to have we will be up and running with that Community Advisory Council. You'll hear more about that toward the end of the year. So stay tuned for that, because I'd like for everyone to have opportunities or potential opportunities to be a part of this Community Advisory Council as it becomes a potential opportunity for us. So thank you so much. I'm looking forward to having this group of community individuals to be highly engaged with us.
Thank you so much, Kimberly. So Rashad, the next question is for you. Now, we've said from the very beginning that the funding that we receive would last for about 5 years. What is going to happen when the 5 years passes and the funding, how do we think that we will be able to fund and, find important resources for this to continue?
Yeah, it's important to know that the SSHCO, we're designed to be sustainable for the long term. And that's what this is all about, transformation. And we're extremely grateful for the state funding that was provided, because it's enormously helpful as we build a platform necessary in a foundation, including the clinical connectivity between and among our 13 organizations and with our community. Also the jobs and the resources that are being put in place, which we know that we're an economic engine for that. So we're about a year into our 5-year promise there, and but we're working on a very robust philanthropic campaign, so the community benefits from the SSHCO and continue to thrive and grow in perpetuity. And then we'll also need to get with our Medicaid managed care organizations and the State Department of Healthcare and Family Services around additional opportunities for sustainability. So that's our plan. Those are our goals, and we're moving fast along those lines.
Thank you so much, Rashad. So Margie, another one for you. How will the word get out about the initiatives of the SSHCO?
Well, we're going to do this through our website, www.southsidehealthycommunity.com. So if you haven't signed up, you want to make sure that you sign up for it. So we are using our email and our database. And we encourage everyone on our database to spread the words through their electronic and community network. So again, www.southsidehealthycommunity.com.
Thank you, Margie. So Rashad, how does the SSHCO have plans to streamline the referral pathways for primary care providers in our community? Is there a database for resources available? Often a fragmented referral pathway leads to delays in diagnosis and treatments that result in poor outcomes. So can you speak to that for us?
Yeah, so I mean, referral for pathways for primary care providers is extremely, extremely important. And with our SSHCO, the main thing that we have is that coordination of care. And in order to streamline those pathways, you have our community health workers that are working, along with our clinical nurse managers, and they're working with our FQHC partners as well as our emergency departments. And so integrated into those EDs, integrated into our FQHC partners, that's how we plan to streamline our pathways to our primary care providers to ensure that we have that technology connectivity that's there, that we can build that bridge and have those pathways, whereas we don't have the delays in diagnosis and some of the treatment issues and results in poor outcomes that you see. That creates that healthcare disparity gap. And so that's our plan, and that's how we'll facilitate and work cohesively as a team around our care model. I think the technology component is also very important in that plan for our community healthcare workers to be able to build that bridge to know exactly what the needs of our patients are and of our community members are, and to be able to provide the education that's necessary. And so again, I said it from the very beginning, we know our community healthcare workers will be the glue that really holds us together, because they are the ones that are trusted within our community, and they'll be able to access the care needs of our residents, whether it's social determinants of health or whether it's building that bridge to primary care with the resources that we'll have ingrained in our FQHCs, as well as our emergency departments and our health.
Thank you so much, Rashad. Well, to be respectful of everybody's time, we are now at 10 o'clock, so we're going to wrap up. As we've done in the past, any questions that came into our chat or that was emailed to any of us that was not answered this morning, we will send out a response in our follow-up that we typically send out some days after our town hall has ended, and then we will also post it on our website. So on behalf of the board of directors and our new CEO, Kimberly Hobson, we want to thank everyone for taking time to be with us this morning. We ask that you remain engaged with us. Visit our website, southsidehealthycommunity.com, our Facebook page, and our LinkedIn page, all of which is posted on the screen. Follow the work that we're doing, support us, challenge us, and submit questions and feedback to us, because this will only be as successful as you are engaged with us. So we look forward to seeing you at our next town hall. Have a wonderful week, and we will talk to you next time. Thank you.